Okay, guys, it is no shock that our skin changes with age. From sun rays to stress, over the years, a lot can really take a toll on our skin. And if you ever thought about reversing those effects but don't know where to start, we have the director of the Institute of Anti-Aging, Dana Lacconi, is sharing which treatment options are available. Welcome back to studio.
Good to be back. It's been a long time.
I know. It's great to see you. I mean, of course, what I love about your name, the Institute of Anti-Aging. So you educate all of us on how to deal with aging. It's happening. We have to go through it, but we don't have to do it all on, I guess, Mother Nature's clock.
Do it gracefully.
Yes, exactly. Okay, so let's talk about things that can be done, because loss of volume is probably what you hear the most from patients coming in, right?
It really is. So a lot of people don't know the difference between Botox and fillers.
Okay.
Botox stops the muscles from contracting that cause the deep lines, where loss of volume is where you lose the volume under your eyes, your cheeks, your smile lines, marionette lines, your contour lines.
All of that. Okay, so that can happen at the age of 20 as far as volume loss, right?
That's right. At the age of 20, you start to lose 1% of volume every year.
Is there anything that we could do to prevent that?
We can, you know, just kind of do a maintenance on your Botox and your fillers. Just, you know, when you're young, we consider 1 to 2 syringes of filler per year. In your 30s, 3 syringes, your 40s, 4 syringes per year, and that will help just maintain your volume.
Let's take a look at how the face ages, because we have some photos here, which I think is really interesting. We have a mother-daughter comparison side by side, and walk us through what we're seeing here.
Okay, so the daughter, she's 26 and the mother's 64. And you can just see that what happens through the decades of aging, where the volume loss in the under the eyes, the cheeks are starting to deflate. You can see her deep smile lines. You can see her jowling. It's just you lose that elasticity, the collagen, the plumpness in the skin.
You know, here's the other thing, Dana. What I think about when I look at before and after photos from you, it's sort of like you target one area, but yet still kind of show a little bit of, obviously, movement of the face. We don't want to erase everything, right?
No, you don't. No, and so we like to do it lightly, you know, light Botox, you know, just restore that loss of volume. We don't like that over-plumped cheek look or the overdone lips. I mean, some of the younger girls really want that. They want to kind of follow the Kardashian trend, but we really try to kind of keep it so it looks natural.
I always love the before and after, any of the clients coming out, because less is more. We have another set of pictures here, and we're looking at the triangle of youth versus an inverted triangle. Explain this one.
That's right. So if you see the daughter, her cheeks are high, she has a nice defined jaw, and then her mother, of course, it's kind of the inverted triangle, where she's lost the volume in her cheeks, under her eyes, and that's where you can see the jowling. She's lost that definition in her jawline.
But we don't have to lose it all, right? A little touch of magic here and there?
No, and I think if you just add a little volume up here, kind of keeps things elevated, and you know, keep up with the Botox, it keeps your skin tighter longer.
Yeah, and these little tweaks, I think sometimes too, when we look in the mirror, we are our worst critic, but a little can be a boost in the long run, right?
Right, that's right.
I love that. Okay, let's talk about Botox. We talk about this all the time. There are some other benefits that maybe we don't talk about besides erasing the wrinkles?
You know, a lot of people don't understand, but you could actually put Botox in the chin, or you get that cobblestone appearance, or the clenching where you're grinding your teeth and it causes the dimpling on the platysmal bands. You know, if you can see these.
On the neck,
On
basically.
the neck, yeah, it will soften those bands.
So we're injecting it right into the neck.
Yeah, and it doesn't even hurt.
Okay, and also underarm sweating?
Yeah, you could do underarm sweating. It's called hyperhidrosis, and it will typically stop sweating for about 6 months.
Oh my gosh. Okay, so we went through all of that. This is great intro, but now we're going to see the magic happen right before our eyes. Dana did not come alone today. We're going to send it over to Derek, who is hanging out with Dr. Lacconi, and they're diving into everything we need to know about fillers. Are we going to do it on air?
Yeah, I think we are. Our viewers love this. Courtney and Dana, thank you so much. Back now, Dr. Lacconi, along with your patient Blanca. I understand you have been a client of the Institute of Anti-Aging for about 10 years now. And I have a million questions about Botox and fillers. And even the other day, I was with a friend who We have time for that. A friend who had Bell's palsy and Botox totally fixed everything. That's a story for another day. But let's talk about loss of volume, Dr. Laconi, in the face. What are the areas that people typically would notice where this volume loss occurs?
Probably number one is the cheeks. So
Okay, right
when
on
we
here.
start off life, we have a nice, full, rounded looking cheek. It's a sign of youth. And with time, that cheek fat pad begins to atrophy. It also loses some of its structural components, so it sags. So it's kind of like the party balloon after the party's over.
Okay.
And so, yeah, and so now Blanca doesn't really have these changes to any significant degree, but it's still just, she's trying to, I'd say, get in early and kind of keep this preventive maintenance, if you will. It's much easier to do it as you go than trying to catch
fix
up
it,
after
right.
10 years of neglect.
Just a little bit of maintenance here and there. And I think we're going to take a nice close-up to Blanca's face. I understand, Dr. Laconi, you actually already injected one side of her face, one cheek?
Yesterday,
Okay.
we injected the little area right here. Now, if you look over here, she had a little hollow there.
Okay.
And so she wanted to put a little filler, so we came in and we put a filler just in a little triangle right there to get that little, shadow. And so if you can see a nice close-up, you'll see that this one, the shadow is not, it's
Right.
more
It's
evident.
slightly different. You can see a little more volume on
Yeah.
that side. You can also do crow's feet, correct?
Absolutely, you can do just about anything. Now that's more of a wrinkle injection. And if you are late to the party with Botox, you're coming in at 45, 50 years old and you've got deep crow's feet, the Botox will need some help from some filler to really smooth things out. Now if you start in your earlier years, before those deep crevices appear,
Yeah.
then you just relax the muscle that causes the crow's feet and away they go.
Take care of them before they begin. Okay, so this is the before pic of Blanca. This is before the injection you did on her cheek, where we can see that she's scowling. And because Botox takes about a couple weeks, right, to see the full effects.
The full effect.
You also did Botox, what, a couple weeks ago?
No, we actually did the Botox, what was it, yesterday.
Oh, just yesterday. Okay, so starting to feel some of the effects. Can you still scowl a little bit?
It's already.
Oh, wow. So it's already
doing a very nice job.
Can we get a shot of that? Can we see Blanca's scowl there? Scowl again. Look at that. Okay, see, that's a remarkable difference.
Yeah.
And Botox is not filling the crevices. It's just paralyzing the muscle. Let's get to the injection here. We've got about a minute left.
So what we're going to do today is I'm going to do this little crease here called the nasolabial fold. Some people call it the
smile line?
parentheses or the smile lines. Yes.
Okay.
We gave her a little numbing, and then I'm going to use this thing called a cannula, which is not sharp, and that will mean that she has much less bruising, if any,
Okay.
after this procedure. So, basically, after we do this, we put our glasses on,
That's a good, that's a good step for it.
and then
And Blanca didn't
I
even
make that
flinch with
one
that
little
first one.
tiny hole, and through that I introduce this long device, which won't cut or damage, little blood vessels down there that are known to cause bruising. So we're going to just go ahead and inject, and this makes this process something you can do and then go out the same day.
Look at that, and not even a
So
flinch
this is
from Blanca.
truly a lunchtime procedure, and you don't even have to miss your lunch.
And we should point out that Juvederm is made of hyaluronic acid, which is something that our bodies naturally already produce.
Absolutely.
Over time, this will fade. How long will this last?
This is going to last 2 years. This is Voluma.
2 years. Okay. there
Juvederm
you have it.
Voluma.
I'm going to let you continue working on Blanca there, Dr. Laconi. Thanks so much for coming by. I could watch this all day. I still have a million questions. Dr. Laconi, Dana Laconi, Blanca, thanks so much for coming by. You look great. Very, very nice.